I know needles can be scary, but that's the only effective way to administer your testosterone. So one big topic that we have for patients, new patients of Magnus Medical and potential patients of Magnus Medical, is that testosterone replacement seems to be, at a glance, difficult to do, either difficult to get into in terms of just signing up with a clinic, because a lot of people look at a clinic and just go like, oh man, that seems like a lot of work. Maybe it's really expensive. Maybe it's really hard to get in with the doctor. Do they have to take my insurance? You know, all these different questions, because it's a very like shrouded kind of gate-kept community or business in a sense. Not a lot of people know a lot about clinics, so that information isn't super readily available, hence why we're trying to make these things really readily available for everybody and all the information that they have so that they can make a proper choice. Part of that too is how difficult it is to get it prescribed. So when you do know sign up, is it difficult to have testosterone prescribed to you? Is the doctor going to give you flack for taking other compounds? Is the doctor going to prescribe it to you if you have levels of 500 or 600, which is considered like a median? Is the doctor going to go through, oh, we get this a lot, like people that are in veterans will go to the VA and they'll have levels of like 350. The chart will go from like 290 all the way to like 800 or something. And if they're not exactly at that 290, which is considered low on the test, then they can't prescribe the testosterone, which is ridiculous. They're right there on the cusp of it. They're experiencing symptoms, stuff like that. So when you go to a VA or a regular hospital or a regular urologist, they'll typically look at straight barriers, like more hard barriers for what qualifies people for testosterone replacement therapy, versus if you go through a specialized clinic like Magnus Medical, where we have providers that are specialized in this field of medicine and these specific medications. They're going to have a lot more experience with this, and they're going to be able to go, okay, you know, your levels are here, your activity level is here, your medical history is here, your family history is here, and you're experiencing side effects A, B, and C. Yeah, I mean, regardless of where your levels are at, you know, even though your levels may already be low to begin with, yeah, you do qualify for testosterone therapy because of A, B, and C, and there's no reason for you not to be on it, so we're going to prescribe it to you because it's just where this makes sense. And that's why it's very important that, you know, I will even say, you don't even have to go through us, through Magnus Medical, but just go through a specialized clinic. There's a ton of great ones out there. You got Merrick, you got Transcend, you got Frontline Alternative, you got us at Magnus Medical. Go through a specialized clinic that has doctors and nurse practitioners that are specialized in this field of medicine, and they will be able to give you the proper information, what testosterone replacement is, how it works, how you can qualify for it, and give you better information than maybe a doctor that only prescribes testosterone replacement, you know, once or twice a month, rather than a doctor that's prescribing testosterone replacement 100 times a month, because that's how many patients are coming in. So those are all very important factors. You know, we have people that ask, you know, if you have high testosterone levels already, let's say high, you know, that's relative, but let's say high is, you know, 700 or 800, you know, can you still get prescribed testosterone replacement? The short answer is yes, you can. Because again, it's dependent on many factors. It's multifactorial. It's not just based off of that nanogram per deciliter level. Now, are you less likely to get it prescribed if you have a higher level? Of course. If you already have a higher level, then typically you won't have the side effects that someone that's at 300 will have. Again, typically. So we might have someone that's 700 or 800 and they're experiencing the side effects of low testosterone. You know, we may not go straight to testosterone therapy. You might go with something like enclomiphene or HCG to help boost natural levels and not shut down your natural testosterone production immediately, your testicular function. And if that doesn't work, if that doesn't mitigate the side effects, then we'll say, yeah, it's time for you to get on testosterone replacement therapy. You got to fill up that syringe and needle and get to it. That's another thing that we get asked to, you know, is there other forms of replacement therapy other than, you know, injecting yourself? Because, you know, I think that's a little bit of a stigma, especially nowadays. You think injecting anything, you know, whether it's a medication, a drug, whatever you want to consider it, it's like, wow, that's pretty intense. You're injecting something. It's just a form of administration. It's the best form of administration, really. So when you have testosterone at its raw form, you can have an oral testosterone, you can have a cream, you can have a nasal spray, and you can have an injectable version. The oral version, complete garbage. Don't ever let anybody have you take that. Oh, I actually missed. There is a is the pellets as well, where you do an incision, a small surgical incision, do the pellets. We'll talk about that too. The oral version, complete garbage. I've seen studies of that with oral bioavailability being less than 3%. Don't ever take oral. Testosterone cream, Androgel, is the FDA approved version. Can work. I've seen it work. And get people up, a couple hundred nanograms per deciliter sometimes. Only problem is it's messy. It's really hard to dose. It's not my favorite form. Nasal spray, we've had some experience with nasal sprays for women. Typically not for men. Again, just not the best bioavailability through the nasal version. The injectable version is 100% the best version to be able to do it, and typically the least expensive. You do have the pellets as well. The pellet side, me personally, I'm not a big fan of, just because I get the idea of using a pellet. In order to do a testosterone pellet, they come in a little cart like this. You make a small little insert, they're smaller than that, but you make a small little incision, usually in the glute, and then the doctor will insert it in there, stitch it up, and then it will stay in there for typically 4 months or so. The issue I have with the pellets, while it being nice that you don't have to inject yourself twice a week, if you get the dosage wrong, that thing's stuck in there for 4 months. You can't get it out. It's got to dissolve. So I'm not a big fan of that. We don't do that here at Magnus, obviously, because we're telemedicine too, so you have no place to go physically in person to do that. The injectable version is very inexpensive. If you just did a really basic testosterone therapy, it's under $100 a month for a male. It is easy to do. If you have an issue with the dosing, if you are dosing too low or too high, it's very easy to just change the dosage on a syringe. Doctor prescribes a different dosage, boom, you're ready to go the next time you do your shot. There's a lot of different information out there, but that's why, again, going back to my original statement, we highly recommend that you go with a specialist clinic that specializes in testosterone replacement therapy, that does these type of prescriptions, that works with this type of medication, and works with patients that have these side effects of hypogonadism, and then you'll get the proper care that you should receive from going to a doctor for that.